So what I'm going to talk about is the mother-baby healthcare crisis in Central Africa. When you hear this talk, you will say in many parts that I already know this. I have already read about it. So what I did was I reached out to several healthcare experts in Africa, and I have their recordings, and I hope in the electronic system we'll get to hear firsthand the difficulties that mothers, babies, and the rest of the societal leaders are facing there. This is a long introduction. You don't need this. Central Africa is one of the most beautiful regions in the world. You look at it, I have been to some parts, I have not been to other parts because the United States government, gives you some restrictions. But if you look at it, just take pictures. It's beautiful. Water, valleys, grass, just awesome. However, when you look at mothers, young mothers, you look at infant mortality rate, your heart bleeds. Infant mortality rate, 44 to 59. Under 5 mortality rate, 73. And you heard a lot about it from Wally's talk. If you look at the need for consolidated health efforts, you look at this region, and this is where the problems are. And there are several theories. One of is that we need efforts. One is that there could be a genetic issue, which is largely limited to this area. Because there have been several studies, like when you started iron supplementation, and I'll go to that later, there was increased morbidity in some areas. So the problem might not be that simplistic, and we might need to study it in more detail. The situation is improving. I'm not saying that nothing has changed, but there is a need for consolidated healthcare efforts. If you look at the under 5 mortality rates, you see the central, east and west, the central part of Africa, which is the most severely afflicted. The northern part looks gray, not because it is all fixed, but sometimes there is a lack of data from these regions. So the mother-baby healthcare crisis in Central Africa, let's look at it in a little more detail. Maternal healthcare in Central Africa faces significant challenges. There is paucity of essential services during pregnancy, childbirth, and postpartum labor. So before the baby is born, while the baby is being born, and after the baby is born. Limited healthcare infrastructures, shortage of skilled healthcare professionals, poverty, cultural barriers prevent good care in all the 3 phases. There is a problem. Maternal mortality rates remain high in many regions. Improving healthcare requires expanding access to clinics and hospitals, training and retaining midwives, doctors, providing healthcare medicines, providing healthcare education, family planning, and safe pregnancy practices. Did I leave anything here? So the system needs a pan-system improvement. Community outreach programs and governmental policies that address social and economic barriers are needed for ensuring safe pregnancy. Again, the same story. I didn't leave anything. So when you develop a healthcare system, if you list out the needs of the hour, I didn't leave anything. The whole system requires the world to get together and think about solutions. Now, this is one of the recordings.
Pregnancy in Africa. Pregnant women in Africa face significant challenges. Some of them include limited access to quality health care, moving long distances to the health facilities where they are meant to deliver from, and many others. These challenges severely impact the neonatal life, whereby they can bring about complications like premature births, low birth weight, and many other complications to the newborns.
When she spoke, you hear and you say, Akhil, what's the novelty in it? But when you listen it again and again, you feel that there is a desperation, there is a sense of resignation, there is a sense of pain. And it's almost like people are on the verge of giving up. So we all need to get together and find solutions. It's very hard to pin blame on something, that the system is not working. But the question is that questions are everywhere. What we need is answers. So let's keep going. Perinatal. So prenatal, perinatal. Perinatal healthcare in Africa focuses on the health of mothers and newborns around the time of birth and has had limitations. High rates of maternal-neonatal mortality, often linked to limitations of the system, that is at the time of birth, we know it. Complications during labor, premature births, infections, poor maternal nutrition, so I listed everything. Strengthening perinatal health care needs improved access to quality antenatal and postnatal care, training healthcare workers, and safe delivery practices. And again, I'm repeating something. Oh, sorry. Thank you for it. And so again, there's a need of community-based programs, and that's because there is a pan-system difficulty. There is hardly anything is left. There is a difficulty, and we all need to get together. Because I'll come in one of the subsequent slides, that it is, as Wally has mentioned, in many countries, the United States doesn't even give visa, because it is a difficulty when you go and visit Africa, your own safety is in danger. So community-based programs that raise awareness about maternal and newborn health, support for breastfeeding, and encouragement of early postnatal visits are needed for improving outcomes and reducing preventable deaths. Postnatal health care. So the problem is in all three phases: before birth, during birth, and after birth. Postnatal health care focuses on the health of mothers and newborns after the time of birth. Monitoring for complications such as infections, hemorrhage, and postpartum depression, but many women lack access to that during this time. And the solutions might not be this simple, because and I'll show it in one of the subsequent slides, people said women have iron deficiency anemia, and they started iron supplementation. When they did, the morbidity and mortality from other causes increased. So assuming that the knowledge we have in the West or in other parts of the world can be directly extended to Africa is wrong. Because there might be a genetic basis for why individuals or why these disorders have become selected during evolution. So the solutions are probably more complex. Limited healthcare infrastructure, definitely, because the per capita income is low, and there are systemic issues where the investment in developing healthcare systems has not been there. We know that. Cultural practices, low awareness about postnatal checkups contribute to high maternal morbidity and mortality, sure. Strengthening postnatal care, I'm repeating myself, we need home visits, clinic checkups by trained healthcare workers, education on nutrition, family planning, breastfeeding, warning signs of complications, and integrating mental health support. Community outreach, same thing, but we need it. and governmental initiatives. We need it. And this is something, encouraging governmental initiatives is not the same as starting a governmental initiative in Europe or in the West. This is something that is far more difficult. That reduce social and economic barriers, those are needed to reduce or to enhance maternal-neonatal recovery after birth. There is a need for infrastructure. We know that. And this is in all three phases, but let's focus on postnatal health care. Many regions lack well-equipped hospitals, maternity wards, neonatal intensive care units, limiting access to life-saving interventions during pregnancy, childbirth, and postnatal period. Sure. The world needs to come together and say, we need to do this. Transportation networks, desperately needed. We need to cover long distances to health centers in a safe way to enable timely care, especially in rural areas. Investing in healthcare infrastructure, you cannot imagine that the whole country might not have the minimal healthcare infrastructure which we just assume in the rest of the world. There is a belief that we understand the difficulties of poverty in the rest of the world, but go to Africa, you will see it. Modern clinics, reliable medical equipment, clean water, electricity, and skilled staff, all essential to ensure safe deliveries, effective newborn care, emergency care for complications. Strengthened infrastructure combined with community outreach and education can definitely improve the healthcare outcomes for mother infants. There is a need to prevent infections, and these infections are different. During the perinatal period, the mothers and newborns are vulnerable to infections such as sepsis, like anywhere else, malaria, HIV, and neonatal tetanus, still there. And during the first neonatal period, as in the other regions in the first month, the prenatal, postnatal area, immediate, consolidated, you will find there are gram-negative bacteria. In the West, we're talking about group B streptococcus. But that doesn't work in Africa. And this may be an issue because of climate and the physical conditions, not just because of poverty. And this has to be looked at. The antibiotic resistance, we say, oh, there is antibiotic resistance because we give too much antibiotics. But we are talking of giving milligrams per kilogram in a newborn. In a mother, we're talking about grams of antibiotics. We're talking about much greater difficulties if a woman, I'm sorry to say this, if a woman does not have access to sanitary pads and she's using cloth rags, then there is contamination from the rectal bacterial flora to the vaginal cervicovaginal flora. And we just did a study, 15% bacteria in the cervicovaginal area are gram-negatives. You do not see in the West. If you're in the West, you're talking Gardnerella and blah, 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 and you're talking group B streptococcus. When I ask in the African area, are you missing group B streptococcus? People are saying, oh, we do not have the facilities to detect group B streptococcus. I'm sorry, that might not be the case. Preventive measures include timely antenatal care with screening and treatment for infections, safe delivery practices in hygienic conditions, and proper umbilical cord care. I talked about neonatal tetanus. Immunization for mothers and infections, promotion for exclusive breastfeeding, and education on hygiene practices can reduce infection risks. There is a need for strengthening healthcare facilities and training for professionals. Sure. Genetic factors contribute to high infant mortality, and this is something we need to absorb, that these disorders might have come in because they give us survival advantage. But why in this particular area? We need to together think about it. hemoglobinopathies, sickle cell disease, thalassemia, glucose 6-phosphate dehydrogenase deficiency, congenital malformations, inherited metabolic disorders, genetic susceptibility to infections, and consanguinity-related risks. Now, yes, there are certain cultural factors, but as I'll come over in subsequent slides, many of these genetic mutations give survival advantage. So just saying that this is because of bad hygiene or because of certain religious factors does not answer the whole question. Frequency of hematological genetic disorders in Africa. I apologize for the small font. On the top left, we are talking of sickle hemoglobin. This is the trait. On the right, there is alpha thalassemia. On the left lower, there is G6PD deficiency. And on the right lower, there is apolipoprotein L1 mutation, G2 variant. And what you see is that it appears that in the top of Africa, the health situation is better. It's not. We just don't have the data. You go to the middle part, you have data, and there are difficulties. And that extends to the lowest part. It's just a difference in what kind of genetic mutations you have. This is an intensity plot. I stole it from a paper. I do refer to them, so nothing bad. And this is hemoglobin S allele frequency, and you see it again in the regions I mentioned. I wanted to emphasize it. Non-medical limitations in access to healthcare. This is something we have been talking about, that there is a sort of a dimension beyond poverty, beyond healthcare, beyond genetic issues. Women face significant challenges related to crime, both as victims and in some cases as offenders, driven by social and economic pressures. Gender-based violence, including domestic abuse, sexual assault, human trafficking, remains widespread and often underreported due to cultural stigma, fear of retaliation, and weak legal enforcement. If you speak with the leaders from this area, the stories get horrendous. I don't know if that is our first goal, because when we're talking about infant mortality of 40 to 60, then our goals might be, to reduce from 60 to 40 first, and then go lower. So there is no point in getting caught in crime. We start at 60, bring it to 40, then 30, then 20, and that would be the time when we think about this crime issue. I talked about poverty and limited access to education and employment. I've talked about that earlier. Petty theft, drug trafficking, sex work, often because the individuals have to survive and the governmental support is not there. So just saying that the society is bad is not going to solve our problems. In the efforts of GNS to identify where to focus our efforts, I found some opinions. So let me see if I can play it.
Hi, everyone listening to this audio. I got a chance to work with an international organization.
Low volume because there is a degree of fear.
Travel in various countries, especially in Central Africa. Among those countries, I can name Togo, Cameroon, Gabon, and Guinea. What was shocking to me while I was traveling, especially in Cameroon, it is the way young girl, the problem that the young girl was facing during the pregnancy and the problem that they face after they gave birth and the newborn baby.
The volume started low because this person was afraid. Because I asked him, and he was like, "Doctor, do you really want me to say it?" I said, "Unless you say it, the world will not know it." And he said, "But the difficulty is if I say it, I'm not sure about my own and my family's safety." So there is an issue. But once he started speaking, then, the volume
Some of this girl came from a poor family. They didn't have any money, so they was exposed to prostitution. And then, as a result, they fall pregnant. And then when they get pregnant, in most cases, they don't know who got them pregnant. And then by the time they realize they're pregnant, probably the pregnancy is already like 6 months. And then during the pregnancy, they don't have access to healthcare. And then, as a result, they give, maybe during sexual activity, they get contacted by infection disease that give birth to unhealthy baby. And then, during the pregnancy, I noticed they didn't have access to healthcare. So that's the first problem that I identify in that category of poverty.
And now here the third part. So the volume itself, it's a bad kind of art. The volume started so low. And then when I play the third part, you hear the agitation in the voice.
The biggest problem, another problem, the biggest one of course, which is that they are actually organizations that wants to help. And in Western countries, Europe, in America, these organizations send funds to support this type of problem, but the money never gets to the people in need. That's the problem. Because the people in need, if they were getting their money, it would solve a lot of their issues. So that's a big problem that I see, or that I saw. Let me put it that way.
You know why this agitation? One of his family members was, his face was covered and he was decapitated. Why? The organs were used for transplantation. And he wanted me to play this. And I said, that does not help achieve goals. Let's start where we can change something. The situation is that bad.
Some of this girl, hi.
The mother-baby health care crisis, we continue with non-medical reasons. There is this concept of criminality and resilience. So there are some areas where this criminality is very high, but the resilience is low. Other areas are high criminality, high resilience, low criminality and low resilience, low criminality and high resilience. I'll explain. Resilience is the capacity of a criminal organization to withstand external pressures, such as law enforcement and internal shocks, and such as identification and arrests, while adapting to continue its operations. So you understand what I'm saying? The low resilience areas might be where we might need to target. Sources of resilience can come from network structure. These are interconnected networks with specialized roles, which makes an organization resistant to disruption. In the West, or if you go to 1940s, we would call it mafia. Institutionalization. Established organizations show or exhibit stronger hysteresis effects, making these more difficult to break down. A stronger mafia. Environmental factors, lack of effective state opposition, can contribute to the resilience of criminal enterprise. So that's why these four areas. Mother-baby healthcare crisis, it really needs to say, we need to watch it, we need to observe it in a fetal, newborn, and infant continuum. Because when you look at ultrasound, you can see the fetus sucking its thumb. You see the fetus sometimes as if the fetus is smiling. So it's just that the environment, it changes from an aqueous environment to an aerial environment. But it is the same baby. So when we go from there, now let me look at it with you in a panoramic view. And this is, you can call it a summary, or it is an aerial view. So we look at an agent, host, and environment model. Agent, high infant mortality, a combination of health, socioeconomic, and environmental factors. Key reasons include infectious disorders, infections such as malaria, pneumonia, diarrhea, HIV, AIDS, and sepsis. High causes, agreed. Host is malnutrition, poor maternal nutrition during pregnancy and insufficient breastfeeding, or complementary feeding increase susceptibility to illness and reduce survival rates. Agree? Like if the baby is not having sufficient nutrition, more likely to die. We all agree. Complications during birth, premature birth, low birth weight, birth asphyxia, lack of skilled birth attendants contributes significantly to infant deaths. And then I was talking about genetic susceptibility. The assumption that my genes are your genes does not make sense. You go and buy clothes. Your sizes are not my sizes. So this is something that has to be looked at very, very cautiously. So the drugs I'm using in the United States are not the drugs I would use in Botswana. The third is environment. And environment we need to look at in two parts. One is healthcare, one is sociocultural. Because when I look at everything in the published literature, it sort of dilutes it as to what should be our goals. How do we fix? How can tomorrow be better than today? So access to healthcare workers. Many families, especially in rural areas, they lack access. Infrastructure, shortage of hospitals, neonatal units, essential medicines, trained healthcare, absolutely, no doubt about it. Third is an acronym called WASH, Water, Sanitation, and Hygiene. WA came from water. Contaminated water and inadequate sanitation increase the risk of diarrheal and other infectious disease in infants. And I'm talking about early onset gram-negative sepsis, which we do not see in the West. When, there are 6 bacteria which cause infections in newborns. E. coli, Klebsiella, Enterobacter, there's one more, Klebsiella, and Pseudomonas. Edwardsiella, E. coli, Klebsiella, Enterobacter, Edwardsiella, Pseudomonas, and Staph. These are the 6 ones. But in the West, these are all associated with late onset sepsis. In the peri-equatorial tropical countries, these infections can be seen in the first 72 hours after birth, because the maternal cervico-vaginal flora is already colonized with these bacteria. Poverty-related socioeconomic barriers, financial constraints often prevent families, and you don't have a possibility of accessing healthcare facilities, nutritious food and medications, and their cultural practices and lack of education, delayed health seeking, low maternal education can all affect. International organizations such as UNICEF and WHO are trying to expand immunization. We have had successes. We have eradicated polio from large parts of these areas. So I'm not saying everything that needed to be done has not been done. Promoting healthcare skilled birth attendance is needed, but the progress has been uneven. This is something to be remembered. So what I want to bring, people were asking, Akhil, why are you presenting this? The goal of this presentation was to bring information, to stimulate thinking. We need to think about how to improve together. I don't have all the solutions, neither do you. but 2 minds are better than 1. And we need to come together and think. The problems are evident, but assuming that the remedies have worked elsewhere in the world will also work here is simplistic. There have been instances, and I've been talking about it, where seemingly logical interventions have not worked here. Like iron supplementation in sub-Saharan Africa has actually increased the risk of malaria. Imagine. So I'll stop here. Thank you so much for your time, and I apologize for the delay because of infrastructure where we could not take questions. But I really thank Professor Wally Carlo for making adjustments. So I can take 2 or 3 questions. I know we are running short on time. Please let me know.